And I invite our next speaker, Mr. Jafri. He's the ex-senior PRO from TMH, and he's going to share about his learnings about building relationships and keeping over the years on balancing and maintaining relationships. So, Mr. Jafri. And I'm going to request all the speakers to keep their presentation a little short because we are running a little out of time.
No. Well, good afternoon, everybody. Well, good to see so many known faces after again some time. As I have just retired 2 months back from Tata Hospital, and I just want to say a few things. Most of the people who are here are well aware of what things are being done. We all know Tata Hospital at this moment is wherever it is. It is basically due to its persistence with dedicated, experienced staff working all over these years. Coming out, I have seen the difference actually. Once I've come out of the Tata Hospital, as Dr. Bharat was saying, I agree with him. When we are in Tata Hospital, we don't get time to do anything or see anything. But there is a very good system in Tata Hospital. That system, I can take some credit from that. I joined in 1990, and well, since 1990, we started 1991 to 1994, I think so. Vandanaji and Viji started their work with us, and we started all these helplines and trying to get all these volunteers to come together. We also tried to organize their systems in Tata Hospital. We found out that a lot of organizations are doing different types of work. So the different types of work needed to be coordinated, and that's what PR department was trying to do all these years. I was listening to a few of those lectures before, and I think so. One of the most important thing which I learned, rather than telling anything else, is that these organizations which are working at Tata Hospital have been working since a long time. And I can quote, say, Vandana Gupta started herself single-handedly. She is still doing it today. And with very, very less professionals with her, sort of. But she gets all the people who wants to help her, and we do. There's a lot of things being done. There are others. I can also, I think so he's left? Yeah, he's left. But St. Jude people are here. I can take some credit from that St. Jude thing also, because Mr. Nihal Kaviratne sir had called me some years back, and then he asked me he wanted to do something for the hospital, something for the patients. And we invited him for one of those programs, and then he actually asked the patients, what do you want? And they said that we would like to have the accommodation because we are getting very costly accommodations here. And today St. Jude is, I think so, one of the highlights in India where patients are getting wonderful benefits, especially pediatric patients. So all these NGOs who are here, sitting here, have done a wonderful job. They have been doing it. I don't need to say anything much more. They are well organized, as he correctly said, Dr. Bharat, that in Tata Hospital, when a doctor sees a patient and wants him to get treated, he does not even have to think that will this patient be able to afford, because he has to just write. And there is a system down here where the social worker, the NGOs, the administration, they all come together and they take care of that patient. And the doctors don't need to worry, and they are happy that the rates of completing of the treatment is being done at Tata with all these people around here. So this is an excellent system which is working. Yes, I would like to also tell about that once you come out of the hospital, as Dr. Bharat said, that it's very difficult for people outside. It is also very difficult when I see that being in Tata Hospital for all these years, that patients land up at Tata Hospital thinking I have come today, I'll get admitted tomorrow, I'll get operated day after tomorrow, and after 4 days, I'll be going back, or 6 days, I'll go back to my native place. This is the perception still with the patients. I agree with her when she says that there are a lot of people at the support group. We have a wonderful support group system in Tata Hospital, but only in Tata Hospital. As he very correctly said, how many percentage of patients are being treated at Tata Hospital? In all over, if you think about all over India, it's hardly, a very, very big number. It's not a big number. So once I'm coming out, I have realized that there are more than 70% of the patients who are actually finding it difficult even to understand that when should they come to Bombay? When should they come to Tata Hospital? When should they actually try to start their journey? Because I had done a study with Dr. Mohandas for out-of-pocket expenses almost 15 years back. And that time I had found out that more than 60% of the money is being spent by these patients out of pocket, not on treatment. Fortunately for them, Tata Hospital takes care of most of the treatment costs. But outside, it's not possible. The people who are going out, it's very, very difficult. So, yes, I know some of these NGOs do work outside. I know some of these NGOs are going beyond Tata Hospital and working in, Sign hospitals and this hospital. But there are a lot of things which can be done in even the private hospitals. The private hospitals will also come forward and they will also want to help these patients because everybody has to do some part of charity as per the law of land. So if all of you come together and tap this, I think we can make a model in Bombay. After retiring, I have been invited by many people, many NGOs, many institutions who want to do a lot of work on this. And I find that, yes, there is a lot of scope. There are a lot of international patients coming to India. They are spending lakhs of rupees only on remaining down there without getting any treatment done. Because everybody who comes here thinks that Tata Hospital will take care of everything. But it's not the issue. The issue is Tata Hospital is overburdened already. In spite of we opening so many centers across India, but I was just in Varanasi last week. There is a waiting list in Varanasi also. Now this is just started and there is a waiting list. In the radiation, we were able to do for 3,000 people, whereas there is a waiting list of another 6,000 people there. So there is a huge scope for all these NGOs and all these people to do some work for the cancer patients overall India. And in that you can actually interact. There is a company which is actually, I'm advising them that they are interested in this, that they would come out with a portal, they would come out on the website where they will, guide patients and all that. As very correctly said by, I think so, from Pfizer, that everything needs money. You can't do without money. You need money. Yes, if you want to do in a broad scale, yes, we do need money. We need a lot of patients. If you are helping, say, 100 patients today, if you want to do 1,000 patients, you will need money because every person, if you employ, needs money. Again, I will name Vandanaji because I used to fight with her and tell her that she has to put somebody, on behalf of we care for a full time in Tata Hospital. But she would say, I don't employ people. I know times have changed. I know she has also started taking people wanting because otherwise, if you don't change, very rightly, there was a topic on change. The most important is, yes, we know that nothing is permanent in this world. Everything needs to change. But I feel that instead of making change in others, instead of making change in the environment, we should start changing our thoughts first. We should change ourselves and we should think that how we can adapt to this adaptability, as somebody was saying. So adaptability is again one thing. By coming on this is, I also found out that after coming out, I found out that, every organization or every NGO actually takes a lot of efforts in educating, teaching, making the people understand, the volunteers, that what they are and how they should go about doing work, because there is an ethics in that also. We always need caring people. We need considerate people in volunteers, especially on the volunteer part of it. We need all qualities which are good enough. They should be able to learn. They should be able to understand. There was a time when our doctors used to teach these volunteers. Now I think so most of these volunteer groups, the heads, they take care of the teaching themselves. So the hospital is not even burdened with these things. They do teach. My only concern is that whenever a volunteer wants to change from one NGO to another NGO, please take care that the NGO should not suffer, because it takes a lot of time for people to educate an NGO into a volunteer into their. There are a lot of people who are doing their work without cost. There are a lot of people who are doing with they are being paid for it. So my only suggestion is that all NGOs should, at their helm of it, they should understand each other very well and go together. Tata Hospital is a very good example of all NGOs coming together and working. As suggested by others, we should also take care to go national wise. Thank you very much.